Hello, everyone. Good evening. Welcome to another edition of Climax After Dark. I am Dr. Mary Ojo Karen. So excited to be here with you all today and have our guest on today, Dr. Megan Jones, a dear friend of mine who is also a colleague in the world of pelvic health, pelvic function, a leading expert in the field. And so excited to have you here today, Dr. Jones. Thank you for being with us and being so giving of your time.
Yeah, thank you for having me.
So, I'd love for you to give us a little bit about your background. And in that, let us know a little bit more about what is pelvic health. What is the pelvis? I think when we think of the pelvis, maybe some of us have a certain understanding, but we may be wrong.
Yeah, so I've been a physical therapist for 12 years. I did a lot of orthopedic clinical work, and then I got pregnant with my daughter in 2019, which really sparked this journey of pelvic health because even 4 or 5 years ago, there just wasn't a lot of information out there for pelvic health. There weren't a lot of pelvic floor therapists, and it was an area that was really underserved for a lot of people. And I was like, we got to do better for everyone. As a provider, I didn't even know how to take care of my own pelvic health. So,
Mm-hmm.
how do other people know how to do it? So, I really got into pelvic health in the sense that, like, we're trying to optimize health and not have symptoms or dysfunction. And what does that look like? So, that's where my journey kind of started. And I work a lot with pregnancy and postpartum right now. And we work on optimizing pelvic floor function and health. So, what is the pelvic floor or pelvic area? So, we're talking about the two hip bones, your spine. All of that makes the pelvis, right? So that's your foundation. And you have ligaments and you have tendons and you have muscles that are even inside your pelvis. And those muscles support your pelvic organs. So we're talking like your bladder, your uterus, your rectum. And those muscles, they need to work really well to have everything else that's functioning in the pelvis work correctly. And so that's where we come in to assess those muscles and assess those joints to make sure everything is working well so that we optimize pelvic health.
Would it be a correct assumption to say that most individuals, when they think about the pelvis and pelvic health, they immediately think about the feminine body and pregnancy?
100%. And we always tell people that everyone has a pelvic floor, right?
Mm-hmm.
Because everybody has a pelvis. The
Mm-hmm.
role in the pelvic floor is to support pelvic organs, and men have pelvic organs as well.
Mm-hmm.
So, pelvic floor dysfunction can affect anyone. It can affect men, women, kids, elderly, whether you've had a child, whether you haven't had a child. It really can affect the entire lifespan. So, yes, anybody can have pelvic floor dysfunction because we all have a pelvis.
And with that, right, my area of expertise where I have spent the majority of my adult life being after I was out of my parents' house, they stopped paying all my bills, has been in the world of gynecology, the world of obstetrics, which again, like I just said, you think of the feminine body, you think of the pelvis. That being understood, and that also saying, I think my training was stellar, but that being understood, um, the concerning thing is that as a gynecologist, as an obstetrician, understanding the mechanics of the pelvis and how pelvic floor dysfunction can impact overall gynecological health is not something that I think we get trained a ton in. And so that leads to a gap in how we are able to give care. And so that's exactly where partnering with someone like you comes in to fill that gap, because we all, as people, deserve well founded care that's well founded and good knowledge and understanding. So, with that, and what my field is now, mostly sexual medicine and health, um, what are some ways that the pelvic floor or dysfunction of the pelvic floor, um, the health of the pelvic floor, how can that impact intimacy? and sexual experiences of not just women, just like you said, men have a pelvic floor too. How can that impact the sexual experiences?
Yeah, so pelvic floor dysfunction and pelvic health has a lot to do with sexual health, right? And we don't think about that a lot of times. We think that, low libido or, pelvic pain it's separate, right? And
Mhm.
these things that I'm experiencing during intercourse or with sexual health are different from how my body is functioning. But that's just not true. There's just so much pelvic floor that's related to sexual health. And so a lot of times what we see are people who might have like chronic pain, like chronic low back pain, chronic hip pain, which might affect their intimacy and sexual health, but really is a pelvic floor issue in its root coming
Mhm.
out as pain and then also affecting sexual health and their ability to experience pleasure. So, a lot of times, what we see is tightness in the pelvic floor. And where does that tightness come from? A lot of us carry stress and anxiety because we live all day, and the stressors of the world impact how our pelvis functions
Mhm.
from different tendencies. And then that plays into our sexual health because
Mhm.
if those muscles are tight, if they're restricted, if they're not moving well, um, the other organs and tissue in our pelvis can't function the right way, which directly impacts sexual health.
Mhm.
And we see a lot of this kind of cycle too, where you have this pain. So then you have this anxiety that then feeds into this fear that then also plays into sexual health and intimacy because you have this um, not only physical cycle, but like this mental health cycle
Mhm.
that goes with sexual intimacy.
So would you say that pain pain is very subjective, right? Um, and I know oftentimes women may not be forthcoming with something that's uncomfortable, especially when we talk about sexual experiences. So the position or the amount of force with penetration may not be comfortable. And so, but I still do it, right? Um, so I'm in pain. Would you say that pain is maybe a common pelvic floor issue that impacts intimacy or sexual experience then?
Yeah, definitely. Pain is probably one of the biggest things that affects sexual health and intimacy because for a lot of reasons, right? When you have pain, that nervous system is really heightened.
Mhm.
And so when you're in that fight or flight mode and you have pain, you're going to be running away, right? And so you're
Mhm.
not going to be able to experience those sensations or pleasure that come with being sexually intimate. So that's one way pain affects it. But then other ways is just that physical sensation. Like, how can you find pleasure in something that is painful? And a lot of times we don't advocate for ourselves when we have that pain. And it could be that we think that's what it should feel like,
Mhm.
that we've normalized some of these sensations. But pain is absolutely one of the biggest things that affects most of the clients that even I treat with sexual health issues.
So let's expand upon that and like talk about then orgasm, right? As we get older, orgasms can change. The strength of the orgasm, the level of pleasure that you get from the orgasm can change for a variety of reasons. And what I'm hearing is, pain can be one because you just can't sense pleasure.
Mhm.
But inherently, let's say you don't have pain, but you just have like, my orgasms used to be a 10, now they're a 3. Could that be also my pelvic floor or a sign of dysfunction in my pelvis?
It could be. Think about as we age, muscle strength and tissue elasticity change.
Hmm.
And so, as those changes occur, those muscles and that tissue surrounds our pelvic organs and our sexual organs. And so, if that tissue is a little bit weaker, if it's a little bit thinner because of aging or just tissue elasticity, that's going to affect how that sexual organ is going to respond. And so we see that especially a lot with women who lose tissue quality, muscle strength, elasticity. that it affects that ability for that tissue to contract correctly
Mhm.
or to its full potential, which then reduces that sensation of pleasure during sexual intimacy. And that's why it's so important that, especially as we age and especially women, that we maintain some sort of exercise or fitness regimen to maintain muscle strength, not only for just general health, but also for sexual health.
So what about men, right? So, a lot of men, um, at certain times in their life, and it's actually young. I mean, really, if you think about it, in our lifespan, having effects on your sexual life or your sexual health can be at ages that we consider to be young. 40. I mean, I'm 42.
Hmm.
I always have to count back, but I'm 42 this year. So, that being said, I feel like I'm still pretty young, but I this is an age where you can really have real changes in your sexual health, pleasure, and all that. And so, men around my age, it is not uncommon to have less strength in your erection. It's not uncommon to have challenges in becoming erect. It's not uncommon to take a longer time to orgasm or ejaculate. But oftentimes men don't want to talk about it because
Hmm.
maybe there's a little bit of like, a less self confidence or effect on confidence, or shame there. But it could that just be like a simple, and not to diminish, the condition or diminish the effect of that on a relationship or in an individual's level of confidence. But could that be something that's even simple in the pelvic floor that, okay, if I fix this, that can at least give me a degree of improvement?
Oh, absolutely. Right. So, especially when we're talking like men erectile dysfunction or like premature ejaculation, we're thinking about this age, maybe like 30s and 40s.
Hmm.
Um, and who are those people? A lot of them are your working people, right?
Hmm.
That might be working high stress jobs, a lot of hours in the week. And are they prioritizing health? What does their stress look like? What does their nutrition look like? And all of that plays into sexual health
Hmm.
and the ability for the body to work the way it can. And so a lot of times we're thought of as the last player of the game, but really we should be that first piece of the
Hmm.
puzzle, right? Like, what can we optimize in how your body is functioning and fix what we can, and then move you on to the next step if needed.
Hmm.
But a lot of times we see people who have tried like medication or behavioral strategies, and they've tried a gamut of things, and then it's like, well, we'll try pelvic floor therapy because we've tried everything else. But
Hmm.
sometimes our solutions can be the simplest of them all,
Hmm.
and can make the greatest impact. So that can definitely be a great contributor to like overall plan of care for people struggling with sexual health.
And I think, like in that relationship, I always talk about like open communication. There's some of that's like open communication with yourself,
Hmm.
allowing yourself to say, I got this issue going on. Open communication with your partner, open communication with your provider, because
Hmm.
to seek care and to get good care, you just gotta be, you gotta be transparent. That's the time
Hmm.
to really just divulge the good information or the information that's there. But I always like to give people deliverables. So I'm in a partnership, and we will make this a heterosexual partnership between a man and a woman. Um, and not changing dynamics of other people, but just saying this: we're giving both ends of the of the line of uh, female pelvic floor issues, male pelvic floor issues, and let's say both have issues, right? What are like some deliverables for that couple, some strategies or resources for that couple, that they can use to help navigate those challenges? Because ultimately, really thinking about it, as we age, we're all going to have issues, right?
Hmm.
We're in this partnership. We have talked. We have decided to be open. But what are some like deliverables that you would tell a patient, a couple? Hey, these are some things that you can do to help.
Yeah. So having tangible choices, I think is important. So let's say this couple is struggling with its pain with any sort of penetration. So how can you still experience, sexual intimacy with your partner, but not get to the point where either person is uncomfortable yet, and setting that couple up for success and just doing things that make both parties feel comfortable. And so really understanding what symptoms are there and what discussions have been had, and then giving them ideas, and that's a lot of it, is
Mhm.
ideas on how you can experience intimacy without experiencing symptoms if you're not at the point where you have fully treated those symptoms yet. So that's
Mhm.
the first thing. The second thing is, I just don't think a lot of our population knows about sexual health and
Mhm.
all the different things that go into it. So, like, a really great homework assignment I give some of my clients is the book Come As You Are. Right?
Mhm.
Learn about your own sexual health, right? And how it affects a partnership. And what does normal look like
Mhm.
versus what the media tells us, what
Mhm.
movies tell us, right? Because there's just so much misinformation about what truly is normal out there. And I
Mhm.
think if we're able to read something or listen to something with an audiobook and understand how our body actually functions, because a lot of us don't get that sexual health or education, and have realistic expectations, that can truly change a relationship for
Mhm.
people who are having symptoms with sexual health.
Mhm.
So I always like to start with the basics and that education piece, understanding how things work, and then stepping stones, right? Small goals to achieve a bigger goal. What can we work on now to continue to promote that intimacy without experiencing symptoms, so everyone experiences pleasure?
Mhm. And I that book Come As You Are, right? I think
Mhm,
that's a great resource. Because you're right, everyone intimacy has different levels,
mhm,
and the goal of sex is not just procreation but it's pleasure and pleasure on both ends. Um, and a great way to receive that pleasure is knowing what pleasures you.
mhm,
And so that can be with self-satisfaction, masturbation. But and I've had a recent patient experience, and um I was not caught unawares, but it just reminded me that if we're talking about sexual health, sexual medicine, because many people don't know what it is, we have to be ready for all comers, right? And so this patient experience that I had a patient that I was treating for some basically tissue issues in her vulva and vagina.
mhm,
There's many tissue issues like atrophy, genitourinary syndrome of menopause, lichen sclerosis. Just the tissue wasn't good, was not able to expand, and was very contracted. And so we were doing those treatments, and I gave her an assignment because I wanted to make sure she was still able to um, have full sensitivity of her clitoris. And so I gave her the assignment of using a vibrator because we did a procedure and I need blood flow getting to that area because of the procedure. That's part of the regenerative part. And so her being aroused and orgasming would help that. So I gave her a vibrator to use at home. And so she came for a follow up and it was time to discuss, did you climax? And I asked her about vibrator use and she said, I used it, but I didn't really feel anything.
mhm.
It's a good vibrator. It's one of those clitoral sucking ones. So you don't have to want to feel anything,
Right.
right? But it's going to happen. So I delved a little bit more and I said, well, did it hurt? No, it didn't hurt. I just didn't feel anything. And I said, okay, so did you do it again? No, I didn't do it again because I didn't feel also emotionally that I wanted to do it again.
Mm,
And I said, okay, went a little deeper. And I asked the question, did you feel self conscious or ashamed of using it on yourself? And the answer was yes. And
mhm,
so, I think one thing, sexual medicine, we are wanting people to be freer and more open, but there's still, and for many reasons, religion, cultural, whatever, there can still be some, I don't want to call them misconceptions, but individual beliefs that impact their ability to be pleased and also know self. So my resolution to that was, you don't have to masturbate then, because if you don't feel comfortable, I'm not forcing you to do self-discovery. Forced self-discovery doesn't make sense. So you can do partnered self-discovery, and maybe this is now a tool for partnered use, because for her emotionally, she feels better having that type of interaction with a partner. And as
Mm-hmm.
opposed to you putting it on your clitoris, your partner puts it on your clitoris while you are having sex. And then if you need to change positions, maybe you hold on to it so he can do another position. Um, I still got to follow up with her, but that she received that. So it still gives her the opportunity to discover self. And I just say that because one thing I always want to get across is, if you're in a partnered relationship or you are uncomfortable with self-satisfaction, masturbation, or even your partner, because there's sometimes you may be with a partner and they don't want to introduce, I like to call them sex tools. They don't want to introduce those tools into the encounter. There's still a way for you to get to that point to where you know what you like, and you're able to be open, so that, to your point, you can use those strategies
Mm-hmm.
for improvement.
Yep. And it's just about, that's it, like meeting the client with where they are.
Yeah.
Right. And so understanding what people value and then what their background is, and then strategizing with them to meet them where they are. And that brings up a great point too, is that like this holistic model of care, right? So
Mm-hmm.
having multiple people involved when you're experiencing these things, because you might not feel comfortable talking to your primary care
Mm-hmm.
provider, but that might be a place to talk to a gynecologist about it. And then maybe bring in a sex therapist
Mm-hmm.
too,
Mm-hmm.
right? And then bring in like the pelvic floor therapist
Mm-hmm.
and maybe a pelvic floor occupational therapist, where we can all create this team approach to really help this person, meet their goals, whatever their goals are.
Mm-hmm.
But a lot of times there's multiple layers when we're seeing these sexual health dysfunctions and issues.
Because we didn't even go into like trauma, past
Mhm.
traumas and how that can be impactful. Can you talk a bit about that, like what your experience has been with past traumas and um, current presentations?
Yeah, so again, trauma definitely affects the pelvic floor, and it's sometimes a layered approach that where we have to kind of break this down with clients, and be trauma informed in the care that we give, but also understand that that does affect the pelvic floor, and we need to make sure that we address it from all angles
Mm-hmm.
to achieve those goals for clients. But with trauma, there's a lot of sometimes anxiety that's related to it, or depression, or emotions that surround that trauma that then affect the pelvic floor. And you'll see a lot of times with people guarding, or people being hypersensitive or hypervigilant, and it affects partners a lot in partnerships. And giving people, again, small, tangible goals that they can meet can really empower them to this healing journey, not only in their pelvic floor, but also mental health wise.
Mm-hmm. Mm-hmm.
And so when you can start to uncover some of these layers and help people move through some of the trauma that they've been through in a healthy and trauma informed way, it can be really powerful for people to not only their own sexual health, but then also with their partnership.
Mm-hmm. What about it's a happy time for most people, but it is a big ask of the body, the trauma of pregnancy, the trauma of childbirth.
Mm-hmm.
How does that impact the pelvic floor? And then can you prepare your pelvic floor for that level of trauma
Yeah.
that will happen?
So it's so interesting because we don't think about pregnancy as trauma to our pelvic floor, right?
Mm-hmm.
So we don't, I don't think we truly understand the magnitude of which pregnancy affects our body and how many changes have to happen for that
Mhm.
pregnancy, to occur and then to have a baby and then for your body to heal. Like it is
Mhm.
not this 9-month process that then just ends when the baby is here.
Mhm.
And that tissue change that affects the pelvic floor for 9 months is pretty significant. There's a lot of weight, there's load, there's stretch that
Mhm.
happens. And that remodeling of tissue can take well more than 9 months postpartum, probably
Mhm.
past a year of tissue
Mhm.
healing. And we can definitely prepare the pelvic floor for some of that trauma
Mhm.
in the sense that, how do we keep the pelvic floor strong and flexible to prepare it for birth? How can we down train the pelvic floor? How can we train the nervous system to prepare for some of those sensations that you're going to feel during labor and delivery? We can train for all of that, but there's still going to be a level of trauma that's going to occur to that pelvic floor that needs to be repaired and
Mhm.
healed postpartum. And we don't take into account that at all, especially when you look at models of care and returning women to work at 6 weeks postpartum, 4 weeks postpartum, and not having that healing time frame that they really need for pelvic floor trauma. So and a lot of people say, well, I didn't tear. Okay, but you still had trauma to your pelvic
Mhm.
floor,
Mhm.
right? There's so much stretch. I don't think people understand how much stretch occurs through that tissue for 9 months. It's
Mhm.
like stretching a rubber band, right? You stretch that rubber band once, yeah, it'll come back down, but you stretch that rubber band for 9 months
Mhm.
straight to get that thing to shrink back down and strengthen and tighten takes a lot of time.
Mhm.
So yes, you can prepare your pelvic floor for labor and delivery. And I encourage everybody to work on birth preparation because it can improve outcomes. There's research to support that.
Mhm.
Um, but we also have to understand that no matter how much preparation you do, there's a certain level of trauma you have to recover from.
Mhm. And we do a lot of preparation for the child and the
Mhm,
home and
mhm,
everything else, but we forget the main thing that we have to prepare for is our bodies for the event. And that's not going to be at your 36-week or your 34-week shower time,
yep,
right? That's going to be really early on. And if you have that ability to have time to do it, you should do it. But then that's also having that community understanding involvement from your obstetrician, your midwife, whomever is your practitioner. Because it's to your point, it's not all about tearing. I
mhm,
delivered somebody this weekend. I'm still delivering, and it never fails to amaze me how the vagina just becomes a whole different thing,
mhm,
and it is no longer this small 2 centimeter whatever opening or potential space. It is a true big space. A whole
mhm,
being is coming out of it. And so if all of that happened to get that baby out, or even just being pregnant and to hold that load, imagine the you need to heal from that. And what media tells us about this like bounce back
mm,
after 6 months, that is a lie. That's
mhm,
not true. That is not real. And those people that have bounced back after their 2 weeks, 4 weeks, they have not bounced back.
mm-mm,
It's not real. And so that needs to be like pushed out of the mind, and also pushed out of what our expectations are, because you remodeled. I love how you use that word. You remodeled for months, for 39, 37, 39, 40 weeks. You are not going to remodel back to what you were in 6 weeks. You're not going to
no,
be remodeled back to where you were in 4 weeks. And if you want to speed up your remodeling back, then you got to do those things that's going to help you, which is have the resources or utilize resources if you are able to. I wish in this country pelvic floor health was a standard of care for
mhm,
a pregnancy. Unfortunately, it's not, but it doesn't mean that, again, that's that gap that I talked
yep,
about at the beginning, right?
yep.
It doesn't mean that it's not one of the most important parts of pregnancy and the postpartum stage.
And I'm sure you see it a lot too with in your practice where people come in and they're just so unhappy with how they look, after they've had kids.
Mhm,
They might have a gaping introitus, like where their vaginal canal is wider, and they're like, well,
mhm,
why is this happening? Well,
mhm.
you gave birth to a baby, right? It
Yep.
stretched. It was gonna stretch. And there's this unrealistic expectation that everything just shrinks right back down to
Yeah,
normal, like you never had a baby.
yeah,
And that's just not what happens. And so you have these people with unrealistic expectation because nobody educates them
yeah,
on those changes that will happen postpartum. So yeah, there's a lot of trauma that happens, and educating people is probably the number one priority right now.
yeah. It's number 1, and then, we are in the Hampton Roads area, like you said at the beginning, pelvic floor care therapy, physical therapy, is really gained steam in this country, and I say in this country again because there are many other countries where it's just a standard of care, especially in pregnancy, but pelvic floor therapy in this country has really started to gain steam in the last decade or so. Um, and you might find many areas where there's one therapist or no therapist. I think we're really fortunate in this area to have many therapists, and it's a very unique thing in the Hampton Roads area that we have. So we are fortunate as women and men to be able to have a place to go, whether it's by insurance that you're able to get there or private pay, whatever. The opportunity is vast here. But there needs to be, I think, a little bit more education on the patient end. But as a clinician who is very transparent, there definitely needs to be more education on the practitioner end too,
Hmm.
of the benefit that goes with caring for the pelvic floor and ailments past pregnancy, past childbirth, and conditions that affect the knee, and conditions that affect the lower back. We've talked about conditions that affect sexual satisfaction. You know,
Hmm.
it's a big part of just who it's our core. It's
100%. Yep.
And I love how you said it because it's true. You may not feel comfortable talking to your primary care doctor about it, but having an open conversation with your therapist, if you have one, or an open conversation if you're a woman with your gynecologist, or a man with a urologist if you have one. Um, but what are some specific tips for guidance maybe that you give your patients? Because you seem to be a very open person, and I know in the room you put people at ease and in comfort. But for somebody who is listening today and saying, "Okay, I'm ready to talk and I need some guidance," but they don't know how to start that conversation. What is a way that they can start that conversation with their provider?
Yeah, so I think the first thing is just being comfortable with the provider that you're seeing, right?
Mhm,
So just making sure that your values are aligning with the practitioner that you're seeing is really important to make sure that you're getting the care that you need. And I think the second thing is that I have this relationship with my clients where they know that they can reach out to me in between appointments and get me if they have questions. And having that open model of communication has been really helpful. But what I find is the reason why they do that is because they forget all their questions when they come in through the door.
mhm,
And so having, a lot of people get nervous when they go to the doctor, and just having a list of your questions and your concerns that you can cover with your provider so that you don't get nervous, you don't feel anxious about it because it's written down and you're going through this list of your concerns or questions or things that you want to talk about can be really helpful for people who kind of have that white coat syndrome when they go to their doctor and just forget everything that they want
mhm,
to talk about. So if there's two things that I would recommend, it's making sure that your provider, you're comfortable with them. And if you're not, it's okay to find somebody else. You
mhm,
don't have to stay with the
mhm,
same provider that you've had for 10 years or that
mhm,
you've been going to since you're a kid. If you feel like you need to change, it's totally fine. And as providers, like there's no we don't hold you, we don't feel any guilt around
mhm,
it, or um, we don't hold any negative emotions towards that.
mhm,
So it's making sure that you align with the provider, and then also that you're clear on what you need help with and what your concerns are. and being able to verbalize them. And usually that comes with being able to write them down and bring that list with you so that
Mhm.
you can get all of your questions answered.
Mhm. That's very good tip. That's a very good tip because you don't want to miss something, because that
Hmm.
time can be precious, right? Because you've scheduled time and you may not be able to recoup or regain or get another opportunity for a while. So writing it down so you can get through it. Um, if you had to give us just one exercise that we could do at home right now to improve the health of our floor, to protect our floor, um, men, women, all comers,
Hmm.
what's that one thing that is easy to do, easy to explain, easy to understand that we all could be doing?
Yeah, breathe. Right. So I think we underutilize how we breathe, right? Again, we live in a society where it's hustle and movement and we're going all day and we're up here with our breath, right? And our diaphragm connects intimately with our pelvic floor. And if we're not using that muscle, our pelvic floor is not working the right way. If we all spent 5 minutes every day where we sat down and we focused on our breath and mindfulness and connecting our brain to our pelvic floor, it can mean all the difference, right? Because we're engaging a muscle that we're thinking about and we're using our breath, which not only trains our nervous system to not be stressed out all day,
Mhm, mhm,
but it also allows our pelvic floor to move through full range of motion. Where we don't move through full range of motion most days, we're usually in a tightened state from either sitting or exercising or walking, where our pelvic floor is constantly tight. So if we can take it through its full range of motion at the end of the day, it can be so beneficial. So taking 5 minutes and really getting your breath to connect to your pelvic floor and getting your mind to connect to your pelvic floor is really powerful. And that's where we start with when anybody walks through the door is how do you breathe and how can we use your breath to influence your pelvic floor to make it healthier?
As you're saying it, I'm doing it. So it's not
Yep.
hard, right? You can do it in moments where
Hmm.
you may be occupied with something else, but internally you're thinking, let me breathe and let me expand and relax and stretch and
Exactly.
all that. As we're
Hmm.
coming to a close, I'd like to ask this question of all the people who participate because I think it's really insightful. You're a wonderful practitioner and you've gained a lot and you know a lot. But there was a time where you weren't who are now. And so if you
Hmm.
had to go back to your younger self in your early days of PT, your early days of learning, knowing who you are now, what would
Hmm.
be one piece of advice you would give yourself then?
Yeah, so don't close the door, right? I'm not a pelvic health person. I don't know anything about women's health. I don't want to know about anything about women's health. And I totally closed the door on pelvic floor as an early practitioner, thinking that's not my lane. But
Mhm,
I think we all need to make sure that we keep this open mind about everything because we don't act or move in isolation and everything affects everything else.
mhm,
And so if I weren't so closed-minded early on in my career, I wonder how many more people I could have helped by
mhm,
keeping that open mind that really all of these systems are so intimately connected and we really need to look at each of them in order to truly make a difference in people's symptoms.
mhm. We don't move in isolation as humans, and our bodies certainly don't move in isolation. It is all
Mm-mm.
connected as we are all connected. I really
Yeah.
appreciate you being here for your insight and your time again. Thank you so much for helping us learn about a little bit more about who we are and the fact that we should be more open um, with how we feel when we're talking to our practitioners. Dr. Megan Jones, thank you so much. Everyone,
Thank
thank you
you.
for being with us. This is Climax After Dark.